Hi everyone, I wanted to talk to you about a topic that we also see very commonly, and that is a double chin. Unfortunately, with aging, one of the common complaints is this accumulation of what we call submental fat, which is fat below the chin. This is something that obviously bothers people, and people lose that sort of snatched jawline. What are the options in terms of treatment? There are a variety of options. I find the gold standard for treating double chin is what we call submental liposuction. This is basically where under local anesthesia, through a tiny little opening under the chin, we're able to suction the fat out. And this way we can actually mechanically remove the fat and you get these immediate results. It looks incredible. Your recovery is really quick. Generally within a week, you see dramatic improvement without going through that major swelling. There are times where actually I combine liposuction with what I call radiofrequency energy internally, and it's a treatment called NYC, where we actually insert this cannula and deliver a radiofrequency energy that also helps to tighten the skin, depending on the severity of laxity that may be associated with that fat. Other treatment options basically involve what we call MyEllevate, which is using a suture suspension to actually elevate the glands and the platysmal muscle in people who have severe laxity. So that is another option. Lastly, it's important to actually evaluate someone's chin, someone who has a double chin, because there are individuals who have basically a recessed chin, which leads to a double chin. And if that is the underlying cause, chin augmentation with filler or an implant may be more appropriate. So that's something I'll discuss in another video, but feel free to DM us, or if you have any questions, you can give us a call. Thank you.